J?
Yes, Stella.
Yeah, is my audio is clear or this background is the fan sound is too much? I just want to know.
For now, it is clear.
Okay.
When you speak for some time, then we'll know.
Okay. Okay, then fine.
It's quite clear, Stella.
Quite clear, sir? Okay, okay,
Yeah.
then. Sir? Not sir, sorry. J?
Yeah.
Yes,
Yeah,
Stella.
The aim is with the QR code we have given for 4999. So I
Hmm.
think for that, let them scan the QR code and register like that. Is that
Hmm.
so? Or because J told only announcement,
No, they let them register.
let them register, right? Okay.
There's only limited, 30 seats.
Yeah.
Session got sold out. So if you want to, to be in the second thing, pre-register.
Okay. Then Jay, get ready with two links. One is handout results link, as I've discussed already, and also with this AMS registration link.
Sure.
But
Sure.
AMS, what is the QR code there then?
I think we need to check that.
Just scan it and see.
It goes to 4999 only, sir.
Okay. For the handout, is there a QR code?
I have a link which I'll be sharing.
Mm-hmm. Okay, but you can put the QR code here, no, for the next time. But
Yeah,
we'll be,
yes, sir. Sure.
but we'll be going fast, no? So
Yeah, yes.
yeah.
And later on, Jay, for this AMS raise up a QR, no? Edit that content to series 2, or let
Okay.
it be series 1 itself. You can name it as batch 2 or something like that.
Okay. Can I take this webinar live now?
Yeah.
So good afternoon, everybody. Welcome to today's Friday webinar. And all our Friday webinars are supported by Healthcare Sector Skill Council. And, today we are focusing on the theme best practices in healthcare. So you would have heard a term called patient safety and patient satisfaction for since many years, no? So, but nowadays, the very new term is coming up in all the healthcare sector. It is about the patient experience. So, if you are giving a good experience to the patient and they are the people who are going to bring a lot of, customers to your hospital. And in that term, many healthcares are working towards reducing the complaint. So this session mainly going to focus on complaint to complement, transforming the patient experience across all the touch points. So let us get into the session. Before that, I would like to take you all to the quick introduction about the skills for med for the benefit of the newcomers. So we have been established since the year 2018, and we have been providing comprehensive training program for all the healthcare professionals to enable and enhance their capabilities in their, in the work practice. So we have 10,000 plus healthcare professionals who have got benefit out of us. And also we have 75 plus hospital network with us, and 50 plus course topics have been launched. And with this 10,000, we are not limiting. Towards the end of the webinar, I would like to show our WhatsApp group QR code. Who are yet to join our WhatsApp community, you can scan and join our WhatsApp group so that you will get the continuous update about our course and program details. And what is the Skills for Med logo? Entirely speaks about. It's a structured, which is build a strong foundation at the first level, which is about the service excellence skills. For example, we cover topics called the healthcare communication and infection prevention and control basic program. And in the step 2, it is about the core patient centric skills. It is transforming a healthcare professional from the competency level into a clinical expert level. And once it's all done in the step 2, it is about look way forward for the specialization, which is about for example, we cover about the clinical instructor program, labor room upskilling program, and infection control nurse course program. And also in a way forward, we are going to have an infection prevention and control program for all other healthcare professionals. And once the specialization skills are done, it is time to look forward for your leadership journey. So we have 2 kind of courses which is covered, which is about the leadership management and also about the healthcare management course. So this is all to have a good outcome in the patient experience. And to know more details about our course, you can contact our Jayanti, who is our admin manager, and also her number is on the display. And also you can visit our website, which is mentioned on the screen. Yes. So today we have a speaker, Dr. Parivelvan Rajavelu, who is a Deputy Medical Director and Consultant Surgeon, Sundara Medical Foundation. And also he is a founder of Skills for Med and the person behind the vision that brings all of us together on this platform. And he's closely associated with CAHO as a mentor, national speaker, GC committee member, and also serves as a chair of EndoSafe, where he actively works on improving endoscopy safety across India. With his clinical experience, research background, and patient and passion for empowering healthcare professionals, he brings very relevant real-world insights to today's session. So welcome you, Doctor.
Thank you, Stella.
So with Dr. Pari, I'll be sharing today's webinar. I am Ms. Stella Thompson. I am the training manager in Skills for Med. So let us get into the poll activity. So let me launch the poll here. So we'll give you 3 minutes of time. So you can quickly jump into the poll and you can start answering for those questions. You have 5 questions, which is not related to knowledge assessment. Thank you. So you have 2 minutes, 30 seconds left. I request all the participants to experience this poll activity. There are really very interesting questions for you all. So you have 1 minute 30 seconds left. So you have 1 more minute left. So 30 seconds left. I could see in last 30 seconds, a lot of people are coming into the poll activity and quickly answering to the questions. So thank you so much. So we are towards the end. Yes. So I'm going to end this poll. Thanks to all the participants who have, actively getting involved in our poll activity. So I have shared the screen with Dr. Pari. So, Doctor, please. So you're there?
Yeah. Can you hear me?
Yeah, yes, sir.
Good afternoon, everyone. Welcome again to our Friday webinars. Again, we are so grateful that so many of you are joining our Friday webinar and sharing the knowledge. So this is about improving our communication and improving our patient perception about ourselves. So the first question is the patient complains about the hospital visit. What do you believe is the single biggest reason behind most complaints? So I think our audience are got the theme of the talk very right. So the way the staff communicated or failed to communicate during the visit is 82%. Okay. So the treatment itself or hospital infrastructure sometimes does come into the picture, and also the processes like insurance, but it is basically, the way you communicate to the patients or not, communicate is what is going to make the big difference. And how often does your current workforce actively collect and act on patient feedback? I think collect is a lot of us will do. So every week, about 65%, sometimes 25%, rarely another 11%. So basically, all of us have got a feedback form. Now, there's no doubt about that. No, it's a service industry, and we do have feedback forms. But how often do you act? That is the question. So we will discuss about that in this webinar. The third question is, how do you feel? What do you feel is the biggest barrier that stops healthcare teams from turning complaints into learning opportunities? So this feedback you get, there are certain complaints which also will come up. And what are you doing about these complaints? So, I'm sure you're getting back to the patient, but do you collect those complaints and in a group and look at it if there is any pattern or learning opportunities. That's what this question is about. So, and what is what do you feel is the biggest barrier, right? Okay, so lack of time, fear that complaints will lead to punishment or a disciplinary action, no clear system or ownership, and staff do not believe. I mean, it's almost equally distributed. You see, the lack of time is what the excuse which often we give, and many of because of the culture, we talked about several times in our webinars. This punishment culture which exists right from our schools and into our work is what prevents this coming out into the open. And of course, lack of systems is the other thing. So which of the following is best describes the current understanding? So a lot of people have said about touch points. I'm very familiar, about 50%. Heard of the concept but not applied it, 26%, and general idea, 20%. So it looks like we have chosen the right topic, Stella. So this is something which is new to our healthcare, and it's good that we're going to talk about it today. And there is one more question.
Last question.
Again, the usual films question. So, which is the film that best captures the idea that small human gestures can completely change someone's experience? The Fault in Our Stars, Tuesdays with Maury, and Patch Adams. I think you start putting Indian Hindi movies. Stella.
Sure, sir. I'll do that.
Yeah, I think even I have not seen many of these movies. But
Okay.
anyway, I think Fault in Our Stars is probably what the audience are thinking, resonates well. Okay, I think that was a good poll. Thank you for participating. So let's move on to the webinar.
Sure. Yes. So look at this picture. This is very familiar for you all. This is imagine this is one of your hospitals OPD. It's 8:30 a.m. in the morning. This OPD looks very full, and the phone has not stopped ringing. And everybody in this situation, in this place, as a healthcare, will be rushing to do our work in a proper way. That is what 8:30 a.m. means, right? It's we are beginning our duty, and it's a day start for us. So imagine at that time a patient walks in for like what should have been a routine visit. So everything is done right for the patient medically. So no error, no negligence, and no complaints about how the treatment have been and the treatment experience for the patient. And yet there is a complaint email arrives that evening in your desktop. So the complaint, it is like to whom it belongs to. Either the patient is complaining about a doctor or about the nurse or about the front desk or about the technician. As because it's a complaint, which is a general complaint about her experience. She have not pointed out any of the department in your hospital. There is something which is lacking is about her experience, what she have gone through when she have visited your hospital. That is about the complaint is about, and we have to really look about that because it's such a disappointing for the patient. So in next 15 minutes, we'll be looking into how you have to, look at the complaint. It is not like attacking us. It is about something, the information you get into your, healthcare system to work on it. And also about an amazing tool, which is going to be dealt by Dr. Pari, which is about touch framework. And I assure that everyone in this room will be able to apply this tool in your day-to-day practice from tomorrow. And alongside, we'll be having real scenarios, interactive moments, and also tool that you can use from tomorrow, which I was talking about. We'll be publishing at a handout resource for you all. And towards then, I'll show you what is actually exciting things inside that handout, for your implementation aspect. So before digging into the solution, let us look where we stand exactly. Why this patient complaints are getting raised in your healthcare system. What actually data says. So this is, one of the study done in BMJ Quality and Safety, where they have categorized the complaints into 3 different aspects. So one is like safety and quality of care. which is accounting for 34%, and management process issues accounting for 35%, and staff patient relationship issues accounting for 30%. So do you think it is all about something what you have done with the patient? Not at all. So over 2/3 of the complaint involved dissatisfaction with the human interaction. Purely it is about how you have communicated with the patient. That's where the complaint have arisen with all this departments. So let me introduce our show patient like Priya, who is 42 years old. She have come to your hospital for the routine follow-up after a minor surgery. So clinically, everything went on well for her. So during her visit, everything clinically have gone right. But what happened is like she have 4 touch points, each lasting for 30 seconds, and it have shaped her entire experience, which have gone worst in her last visit. So none of them were about the medicine. Please make a note of that. So what are those 4 touch points? So we can see step by step. So first thing is about the reception. The reception person have handed over the token number to her, and just please have your token number. So what she have felt is like there is no greeting, because the greeting would have rushed up, or no greeting at all. So no greeting and no eye contact was maintained with the patient when she was handing over the token number to the patient. And in the waiting area, she have been waiting for 40 minutes, and no one bothered to come step in or to explain why this delay is happening and when she can expect to meet the doctor. Which is very unusual. You have been given appointment time for her, and that appointment got delayed, and no one bothers to explain why this delay have happened. And third thing is about the nursing station. Vitals were taken efficiently, no doubt in that. It was performed very well by all the nurses. But one thing is like no explanation of what happens next. That is the explanation in each and every step when they're taking, even the vitals part. It's like whether they're checking the BP or, they're checking the temperature, everything, step by step, they have to explain what is happening and what she can expect in the next process. So that is missing. So fourth thing is about the doctor's office, where she have got upset. The consultation is very thorough. Clinically, no doubt in that. But one thing is like no acknowledgement from the doctor why she have been waited since long, and she wanted a doctor to address about the delay. So that has been missed. So what's actually the Priya complaint actually did. So this is a very amazing image when I gone through this. So thanks to Diane. The content, if you see, the treatment was fine, but I felt like I was just another number. No one told me how long the wait would be. No one said hello when I arrived. I was left sitting for ages without any update. This is the patient, message which I've reached to you all after her visit to the OPD. Priya did not mention, about the doctor's skill or about the nursing care or about any of the things. It is only about how she felt when she came to your department. So look at this image where you can see the iceberg. So this is also one of the analytics which is done in the, in one of the popular hospitals. So where you have many patients will have a lot of complaints about their visit, but only a few are heading up, a few are coming up into a formal email as a complaint where the management can look into it. Where in case other complaints are very informal, which is not documented and which is not taken care of it. So here you can see 9.5% of patients who have raised a complaint actually to do so formally, which will be taken care of. For every complaint you receive, roughly 10 patients would have faced the same, situation when they would have visited your department. So you have to take these complaints. This iceberg, which is the complaint which is given, you have received from your patients, as a signal. You should not think the patients are attacking your hospital or your healthcare organization by the complaint. You have to take those as a signal and work on the process. You have to learn how to read the complaint and what you can do for the patient in a better way. That will entirely change the process, and you will give a better experience when you're good at it. So one question is how to stop them. No, not how to stop the complaints. It's about how to learn from them. Sorry about the screen. Yeah. So 3 things what you can do in the complaints cycle is like you have to collect the complaint. Step 2 is about analyze. Step 3 is about act. As Dr. Pari have said, many of the healthcare system, you have a process of collecting the feedback from the patient where you will get the complaints equally like in the form. You will, you will collect it and you will gather all the information. So there is a big gap in many of the healthcare system is about, the gap is about analyze and the action part. If you're not analyzing it and you're not taking action, then again, the process is getting failed. So you have to fix and act on analyzation part and act part. So let me give this future slides to Dr. Pari to take us through this amazing touch point and amazing framework which we are going to deal about, the touch framework. Over to you, Doctor.
Thank you. Thank you, Stella. I think that was a good introduction to the topic with the very interesting case history which you pointed out. So if you look at all these things the patient is complaining about, the reception which did not make eye contact or smile, and the nurse who took the vitals without explaining what's going to happen next, and the wait where nobody was telling how long the wait is. So this happens every day in our hospital. We are busy. All of us are busy. The doctor's busy. They are bent on seeing the next patient. But what the patient expects is an acknowledgement. So if you look at the whole journey of the patient, there are several such touch points. In fact, this idea came to us when the NABH has introduced the patient experience. I was part of 𝐂𝐨𝐦𝐻's initiative to make these patient experience, that is patient reported experience measures, PREM, questionnaires, and went through an elaborate process. And when we are discussing, we realized that we are in the feedback form, we are not actually asking the patient about the experience. We're only asking how satisfied they were. See, the satisfaction is from the patient's side, and the satisfaction will depend upon the patient's expectation. So some will have a very low expectation, so they are easily satisfied. Some maybe people who are coming from abroad will have a very high expectation and they are disappointed, and others are in between. So, but that is the patient's perspective. But what this patient experience measures is what we are doing to the patient. So when you go to a mall or a movie theater, so right from entering the mall, you're experiencing it. When you get down from your auto or a car and look at the mall, it's all lighted up and colorful and all that. So that is an experience. And we are entering into the mall, the security person, how they are greeting you is another experience. So that's why they'll never put very grumpy looking security in malls, whereas they do it in the airport, because airport security is paramount. Here, hospitality is paramount, right? So the experience are different from place to place, but you are experiencing each and everything. And then as you enter the mall, maybe you look at the ambience, how high the ceilings are, and how there are escalators, and then shops all around. So everybody is trying to enhance the experience of the consumer. But in healthcare, we are so focused on the treatment that we forget that the patient's experiences also matter, and that's the reason now NABH and many other quality organizations have come up with what is the patient experiences. So that is why we are doing this questionnaire. And while doing the questionnaire, we went into, when we were deciding how to make this questionnaire, then we came upon these touch points. So for each and every touch point the patient has experienced, and you got to frame a question to get the patient reported experience measures. So that gave us the idea, why not we make a webinar on touch points and talk about how we could do it, everybody can do it. So you don't need to get, start, you should do Prem, but it's not, you can't do it every day. Whereas, if you have a framework, you can start implementing it on a daily basis. Next slide, please. Yeah, so what is a touch point exactly? So it's any moment a patient feels something. So these are emotional things, okay? So it is not a conversation, it is not just a smile, but it is even how the signage is there, and the way you talk, all these things, or even the silence which is there in the whole area. So that also is an experience. So a patient experience is a sum total of all this. Now, it's very difficult actually to make a questionnaire about it, but we do it for no other tool is available. But there are so many touch points, and what we almost 90% focus is on the clinical touch points, how the treatment is given. No, we focus a lot of that, but that's only 10% of the experience for the patient. The rest of the experience happens outside the consulting room of the doctor. So one bad touch point actually can undo a lot of good work which you have done in the past. So you see here, we have pictorially put some touch points. As I told you, arrival into the hospital, what is the experience in the reception, while they're waiting in the waiting area, what is their experience, when they come up to the nursing station, what is the experience, and again the doctor's consultation. Then they go to the pharmacy to buy the medicine. Is there a big queue, or is it, and how is the pharmacist treating them? Then when they go to the billing, always people are not happy spending money, but you should try and make that experience as painless as possible. And of course, leaving the hospital and how their transport is arranged and all that. So this is only a few of the experiences, as you can now appreciate. So these are called touch points. At each and every of these touch point, the patient is experiencing what you are providing, in the physically, in your gestures and the way you talk and things like that. Okay, say we have color coded this. Green are all the positive experiences, or the yellow ones are often overlooked, where we don't focus much on these areas. And frequent complaints usually happens because patient says, I'm waiting for a long time, or their costs are too high. So this is only complaints are coming, but many of these touch points, there won't be complaints. Okay, so that is very important to remember. Next slide. So you could actually categorize them based on the various the journey of the patient before the visit. How was the appointment? How was the reminder? How was the information access? So recently, our hospital migrated from the operator answering, where because there was a lot of missed calls and drop calls, so they introduced the IVR system. But then, when the patient doesn't talk to a human being, you have to be very careful that IVR is not too long. So that's an experience the patient is facing even before they come to the hospital. How's your website? How's the WhatsApp interface? So all these things before the patient comes, it's very, very important. And then at arrival, registration is the first impression. In fact, I would say the security person is the first impression. If the patient enters the hospital, and the patient and the security is rude and saying, why you come here? No, don't you know there's no visiting time now? This sort of tone puts off the patients. So actually, more than the front desk, the security is is the face of the our hospital, I would say. Then during care, there are several people taking care of the patient, and finally after the visit, what is your, how much you are handholding. This is also another black box where once the patient leaves the hospital, we forget about them. So how much you are handholding them after they leave the hospital is something which we need to look at for the experience. And very importantly, inside the hospital, I'm talking about inpatients, when they get transferred from one department to the other, they say ICU to the ward or from theater to the ward. So this handover process also, there is a lot of experience happening, and this is where most of our cracks are. So this is all the categories by which you can categorize it by any way, but this is one way of categorizing the touch points. Next slide. Okay, so I told you, the patient's, the most important area where the patient falls between the cracks is the handover. So every department, when they hand over to another department, there is a period in between. It's a sort of no man's land. They are neither in this department nor in that department. And even if they go to that department, it takes time for the staff to come and take over the patient. So this period is where the patient experiences maximum problems. So because nobody said immediately there should be someone who comes and says somebody will give you shortly, and no one updates what happens next. And this is where the patient is totally disappointed with the whole experience. Next slide. Okay, Stella will take up this quiz. You can take over and do this.
Yeah, yes, it's a quick quiz. So we have a scenario here. So this is patient Ravi, 55 years old, arrives for the blood work. He checks in, wait for 20 minutes, gets his blood drawn and leaves. Everything was done correctly, but Ravi feels dismissed. So this is the patient situation. So which touch point is missing? I think you can read over the scenario again on the screen. So you have to choose one answer, which is, like you can, either it's a party, like thank you at the reception, which is missing, or explanation of a waiting time, or a follow-up on results, or all of the above. So you can put your answers in the chat box. Okay, they have already started. So, D. Okay, all of the above. So most of them have said all of the above, and I could see answer for B, like an explanation of waiting time. Okay. Thank you so much. Thank you so much. So most of them have answered as either B, and mostly we have got option D.
Yeah.
So yeah. It is like all of the above. We have all got D.
Yeah, as I told you, it's the sum total of all the experience the patient is getting.
Yes.
And positive experience is taken for granted. That is a problem. Whenever there's a negative experience, only the patient starts looking at it. So any deficiency, all those three deficiencies are actually important. No
Yes.
thank you, no explanation for the wait time, and how long the when will the results be shared. Yeah, good.
Yes. Thank you, sir. Over to you, sir. I'll move to the next slide.
Yeah. Okay, so now that we understand what touch points are, so let us see how we could enhance the patient experience in these touch points. And just to remember it better, we have used this acronym T-O-U-C-H. So each one will tell one aspect or one thing which we can do to each and every one of your patients, which will enhance their experience. So it is a structured one, and it cannot be done by just one person. So it's a teamwork. So each one has to take one role, or one role might have more than one or two of these frameworks applicable. So this is only an overview. So I want you to just understand this and then take it and make it your own. Next slide. Okay, so let's start with T. The first aspect is trust. So when a patient enters the hospital, let's say you're a brand new hospital, nobody knows anything about your hospital. Now, how do you build trust? Some of you may come from hospitals which are, say, 50 years or 25 years. Then the reputation is built over time. But that reputation is built by these touch points day in and day out. So that's the point I wanted to make. So what is known as the golden moment in hotel industry. So if you go to any good hotel, the initial minute or 5 minutes is what they focus the most, because first impression is always the best impression. And just notice the next time you go to, if you are traveling, you go to different hotels, you notice that. So the first 5 minutes is where the maximum thing will happen. So right from the security to the front desk and they giving you a welcome drink, all those things are because psychologically it is established that trust is built on the first 5 seconds. Is a bit too short. So it's the first 5 minutes. Okay. So greeting, eye contact, and using the patient name. I read a book called Unreasonable Hospitality. If you have time, read that. And it's actually about the hotel industry, and it was recommended by one of my friend. I was thinking, why should I read about the hotel industry? Then after reading the book only, I realized how much they go out of the way. So it's unreasonable hospitality, right? So this particular hotel manager was so much bent on this that they would, if somebody books, in that, because it is a very, famous hotel with a Michelin 5-star, badge to it. So you need to book your time there. Otherwise, you won't get a place. So anybody books, they would go to the social media, know their names, know about, the family, the pet, and everything like that. And the servers were trained, so in their conversation, to use their names, first names, and also casually mention, how's your daughter, is she doing well in school? We saw your, she attended that, kindergarten graduation. You can imagine how it's not just the food. So it's the same thing. It's not just the treatment. So there's so many things which you can do to gain trust. So imagine how the patient will feel. Will feel if you can initially call every patient by name as they come in to the reception, instead of asking what is the name, what is the date of birth and things like that. Okay, so these are not something which it's an extra. It is the foundation if you want to build trust. And training, training, training. This is what is very, very important. So every staff member who encounters a patient should lead with acknowledgement, and even if they are not the person who's going to do the job. I visited several hospitals or several hotels where when you go in the corridor and some housekeeping person is going past you, they will smile and wish you. You feel good about it, right? They're not directly going to deal with you, but still the whole team works together. So that's a trust. So here you can see very nicely picturized, this receptionist here is looking at the computer and not looking at the person. That's a big problem with the computer in front of you. So you need to overcome that and first talk to the patient, make eye contact, and then do your computer work. Okay, so that is the T. So next is the O in the touch. Let's go to the next one. O is ownership. Now, the patient is everybody's, it's a sort of we have to own the patient. And every staff member is that if I'm the last person to see the patient, I am responsible till somebody else takes over. So this is especially critical during, handoffs, but it is there even in every aspect of care. So that's what I told you. When you walk past or all your staff actually making eye contact with the patient, wishing them, it's very, very difficult, but no, it is just a culture. So that is the ownership. So you need to do in your training saying that, no, it's not the doctor who owns the patient. It is not the nurse who owns the patient. Right from security, we all own the patient who comes to this hospital. So this culture has to be slowly built. It's not going to change overnight. So T is trust, O is ownership. And what is the next one? U. U is updates. We've been telling about this. So you should never let a patient guess what's going to happen next. So you have a rule that 5 minutes is the benchmark. Beyond 5 minutes, the patients will start getting anxious. So you need to make sure you have mechanisms to somebody going and saying, yeah, I know you've been waiting for more than 5 minutes. The doctor's delayed or whatever. And this is where it is happening right now. The 8:10 appointment is going. So it is running, the clinic is running about 30 minutes late. So this sort of explanation to the patient is very, very important. So you can have your own hospital benchmark, you can say 10 minutes. And even if you can't solve the problem, just to say, yes, we are working on it. Okay, so that's just an update which you give. Okay, so it's very important. So again, nicely, picturized here, the nurse just walking past without acknowledging that the patient is waiting for such a long time. And the other side is where, she stops with the patient, updates the patient and then walks away. So these are, very, very important things. So T is trust. And what is O, Stella? I keep forgetting that. Ownership. And U is update. And the next is C. C is communication. So when you say communication, it's a big word. So, but basically here we are talking about your body language. Okay, so as we know that 38% is what you speak. What you are saying shouts so loudly at me that I cannot hear what you say. Somebody said that, right? No, it's very, very important. No, so what it's your, the way you look at a person, the way see your body language is so loud. But many times they don't even hear what you're telling them. So it's very important to work on the body language, and even a correct explanation told in a very dismissive language, patient can feel insulted. Okay, so it is very important again in communication to talk about it. So that's about communication. So let's go to the last one. Humility. It's very, very important. So again, I want to draw you to the picture first. So many times, there are several patients who will be coming and asking, especially, if things are running late or things are not going properly. Again and again, you'll have the same thing coming up. Why is it so late? Why the doctor's not come to the thing? So you will feel frustrated and saying, what can I do about it? That is being defensive. It's beyond my control. I can't do. Doctor is stuck in the theater. So what can I do about it? If you talk like that in a defensive language, it is not going to help. So instead of that, this is what empathy is. Now we keep talking about the word empathy, but you got to put yourself in the patient's shoes. Imagine that you have been waiting there for 40 minutes. How would you feel? And then say, I know this wait has been frustrating. When you say, I know the wait is frustrating, it is not just words. You should actually have, that empathy before you start opening your mouth and saying that. I know how this wait. If you're not just telling it, because of a scripted communication, it will not have that effect. So you need to have the empathy, and you need to communicate, that, why we put the word humility is, sometimes it is actually very humiliating that, no, you have nothing to do with it, that problem, but you are faced with it. No, especially the front office people, it's very, very difficult job. So I will come, 1 hour late from theater, walk into the consultation room, shut the door. It's only the receptionist who are going to face the brunt. And in that thing, I want to point out, the various touch points. So if I come late to the clinic, I will make it a point to I look at the appointments and see who are all have already come before I came, and remember to apologize to them. The first thing, as they're walking in, I'll say, I'm really sorry, I'm late, I got stuck in the theater. That totally disarms, they'll come, with a very grumpy face, and the moment you acknowledge that, they'll say, no problem, doctor. I know you're busy. Okay, so that is, everybody should acknowledge. It's not just for the receptionist. It is right from the top to the bottom that this humility should be there. That, you're humble and, apologizing that, you've been delayed. So that is, friends, is the touch framework. So quickly, Stella, can you go back these slides, and I will, yeah, here is the slide. So touch is the framework. T is the trust. No, acknowledge the patient in at least the first 5, if not 5 seconds, at least the 5 minutes. O is the ownership. Someone always owns the patient, especially during handoffs. U is regularly update. Make a rule that no patient is waiting more than 10 minutes before any update is given. C is communication with empathy and body language. And H is being humble and not talking to the patient in a very respectful way. So all these, if everybody practices it, definitely, the experience of the patient in various touch points gets better. So I think next slide. I think you're taking over, Stella, from here. Yeah. Thank you
Yes,
so
sir.
much. I think it was nice for me, great learning for me to prepare this, and for our team also. We learned a lot about touch points, and we're happy to share with you.
Yes, yes. So let us have one scenario to work out this touch framework. Okay, so there is an anxious relative in the corridor. So this is the scenario outline. So here is a patient, 68-year-old patient, Mr. Suresh, admitted for cardiac observation overnight. And his daughter Kavita has been waiting in the corridor for 3 hours. So I think you all got the point. So available staff. So there is one unit nurse temporarily between the medication rounds. So she is very busy. So doctor currently reviewing the another patient. He is also busy. But here, Kavita is waiting outside the corridor for nearly 3 hours to get an update about her father. So current situation, she is a bit anxious and she has asked twice for the update and she have not received any clear answer from the department. So this is the point where you have to take a decision. Unit nurse is the closest clinical staff member at this moment who can address Miss Kavita. And what should the nurse do right now, even if no new clinical update is available? Sometimes there might be no new update about her father to discuss with her or to update her. But still, when you look at the patient relative who are very upset, in front of you, you should take up some step to go near to them and address what is actually they are going through. What Dr. Pari was saying, like be empathetic with them. So we can see using the touch framework. So you can look at this. Hope you all, you will be easy to, you can, this framework, as he have said already, you can use in any of the department. We have taken one scenario here. You can correlate with your concerned departments. So step 1 is about approach and acknowledge. So the nurse stops, turns toward Kavita and makes the eye contact, uses a name, and which makes her very comfortable when you use the name. And then in a calm way, she's saying like, Miss Kavita, I can see you have been waiting and I understand this is worrying. Let me help you. This is the first thing. Okay. So now Kavita is like very assured that one of the nurse from the unit have come, addressed her, and she's going to get some update about her father. Step 2 is like, go find information. This is not just, sometime in a healthcare system, what I have seen when I was working in a field is like, we go and assure them saying that I'll get back to you in 5 minutes, 10 minutes. But, poor patients will be waiting for you, but you will be getting stuck in other work and you will not even remember to go back to the patient and address about that. But this is a very serious concern where you have to, go back to the patient. So this is here the ownership. So the nurse does not walk away saying that the doctor will come. Instead, she takes ownership and say, I'm going to check with the doctor and review father's chart and come back and update you. So she have given the trust and she have taken the ownership for that patient. And U is about update. So written with update or timeline. Within that timeline, sure, this nurse would have said like, I'll get back to you in 5 minutes. So within 5 minutes or 10 minutes, she have gone to the patient attender, and even with no clinical decision is made, nurse written with the information, something to be in the promised time. So something she has to update, not something it's like related to her father, so she has to update things to her. So what she's updating here is like, doctor is still reviewing your father's report, he is stable and being monitored, and I'll check again in 15 minutes and update you again after 15 minutes if there are no clinical changes or nothing to update very new about our father. But still, after 15 minutes, you have to make sure that you are meeting, that attender as you have promised to meet. So if Kavita becomes visibly distressed or requests to speak to a supervisor, immediately involve the ward nurse or duty manager. So this is what is escalation trigger. So then the fourth point. So we have like the trust, the ownership, and about the update. Next comes the communication. How we are going to communicate. So you have to make the eye contact. Use the simple language whenever you're communicating with the patient attenders or with the patient. Okay, so use the simple language, and it is about like it's been like since longer the waiting time is like the father stable and monitored, check understanding, tell me what's happening. So all those things are like applied here. And step 5 is about empathy. It's about, on a whole, it is about humility in the touch framework. The last step is about acknowledge the wait, because just that is not just going and update her. You also have to value her waiting time. Every for every human being, the time is very important. So the waiting time, what she would have gone through about her father update, she would have got into a lot of imaginations. So you value that waiting time, and then validate the feelings and reassure them. So that is all about in the in the last step. It's about the humility. So, and also you have assured them that you will return in 15 minutes, where again you have to start the cycle. So this is all about the touch framework. Hope you all would have understood. And closing the loop, remember patient Priya. At the beginning of the webinar, we had that patient who had a very bad experience in the OPD. Nobody greeted her, and nurse didn't acknowledge her, did not given any update about what is next, and also doctor have not addressed about a waiting time. So the same patient, same hospital, different outcome, but with the touch framework, how it worked is like brief acknowledgement at registration, simple update during the wait, and also nurse who explains one step before doing. A doctor would take 10 seconds saying, I know you have been waiting. This makes her feel very valued, and all her waiting time distress would have gone with this statement. And a support staff member who makes eye contact and reassures, and no extra time, no extra resources, just intentional touch points. It's all like you're not going to do something extra. It is something going beyond your duty, and you're doing certain things to bring out a better patient experience in your hospital. So this patient, now let us look at like what is the feedback after she have went to her home after the visit to that same OPD. Same patient, you can look into this. I was anxious when I came in, but I felt cared for. Thank you. I will recommend this hospital to everyone I know. I was telling in the title slide, you give a better patient experience, you get a lot of, customers through them. So that is like, one point where they get belief on your hospital, and, they will spread about your hospital, no matter like the marketing things are there. But what is the patient experience they personally have with your hospital? That is how they will bring the patients. So, here the difference was not a policy change. It was not a new system. It was 5 people choosing to make the touch point count. I will insist on Dr. Pari's word. This is something about the cultural change, what they have brought in the healthcare system. So this is how, this positive feedback have landed in their feedback. So as I was saying, this touch framework is not for one healthcare individual. This can be applied for all the healthcare professionals. Let me take you quickly what is there inside this handout. This is the cost of 99 rupees, but it's a really valuable, and it's a quick implementation tool. So you will have 50 plus scripted phrases for your real situations. There are different situations what you have at the discharge. Randomly, I'm taking you billing, confused, phone or reception, emergency situation. And also you have 5-minute daily touch point audit checklist and team scorecard to use it off. And also in section 3, you have about patient handoff checklist, and also OPD to IPD admission checklist to know how the things have supposed to happen. ICU to ward transfer checklist, and you have de-escalation medication decision tree for angry patients. This is very important, and it's you can have as a handout for your department, and post-incident debrief for staff well-being, and also WhatsApp message templates for follow-ups. No, and then you have lab results ready template, medication reminder template, billing clarification, satisfaction survey, and you have weekly team huddle decision guide and data review, how to review that, and the learning moment, skill building, positive visit feedback form, and how to use the survey, and also 30-day implementation scorecard, and measurement and celebration. And this is all about what is there in the handout. I think it have really come out well. Lot of implementation tools. It's not just talking about one aspect, talking about all the healthcare professional aspect. So you have a lot of quick implementation tool. So Jay, I think Jay would have posted the link to purchase that webinar handout. It's going to be amazing tool for you all. Yes, thank you. So it's going to be it's going to be amazing tool for you all. Quickly you can take up. You don't have to do any workout and all. Just start implementing in your hospital, and you can see amazing outcome in your patient experience. So this is all about the handout, and about the February event. So just like all our so AMSP, I have to say, successfully we have launched this course, and thank you. Many of the participants have and still we have many more audience who are in a queue to register for this program. So we have fixed the batch size of 30. So it's the batch 1 is over now. So it's in a progress. So next batch will be launching. So I have an announcement regarding that. And we have online CNE, and we have free webinars. Next 13th, 20th, and 27th, amazing topics are there. And also we have IPC free webinar this month. It's on 18th. Already this calendar is there in the Empower and Empower group. You can start sharing with your colleagues. Even they can register for the program, free programs, and even for the paid programs. And we have paid masterclass for this month. Do you remember Ankita's class on communication? So we have another masterclass from another person. She's Dr. Shalini. We'll share the flyer soon. That's on quality audit fundamentals, preparing for JC NABH ISO accreditation. So that's on Jan 25th. So February 25th. I'm very sorry. So key takeaways. So you have to take complaints as an information. They are the signals. So you have to learn to read them, to work on the process, and to bring out the cultural change among your healthcare system. And every interaction is a touch point, and you would have gone through the touch framework. And also it takes no extra times, it's an intention. So doctor, one thing, if I have time, if you permit, I want to share one of the experience what I had as a patient attender. Because when you were taking through this presentation, I had, so shall I discuss here? Just a short note. Yeah. So I used to take my, one of my relatives to one of the corporate hospitals. So very often, like monthly once, we used to go there. As she is a regular patient for that hospital, she used to get discount for her medication. So what happens is I have advised her stop buying medication from that hospital because of the waiting time. Besides getting the discount on the medication, I have told this because sometimes the medication is available at the pharmacy. Sometimes the medication is not available. To get to know that information, she is being put to stand in a long queue. Maybe sometimes there may be about 25 patients or patient attenders waiting to purchase that medication. There are different medications. Okay. So what I thought, when, attending to this session equally and, presenting this, I thought even for the better patient experience, and Dr. Pari was saying, we used to collect only the patient satisfaction, not about the patient experience. If that one kind of form is given for me, for my relative, I would have recommended to say they could have given 3 kinds of queue. One is more than 10 medications, a different queue, and less than 5 medications, a different queue, and 1 queue for inquiry and with 1 medication. So that could have prevented the waiting time, and also would have given the better patient experience because after the inquiry, the medication is not there. My aunt would have, gone to some other pharmacy, instead waiting for a long time to get that, answer from that pharmacist. So this is just a quick thought. Maybe I am from the healthcare professional getting this thought. Even there are many patient attenders who are very smart at thinking. When we give a blog, blog for a patient experience, they will come up with many points to support the better healthcare system. So this is the point I got up in my mind to discuss here.
Yeah, it's
So
very
thank
true,
you.
Stella. I mean, we only now we have started collecting patient experience.
Yes.
So, hopefully, things will change.
Yes. So yes, so this is another announcement about become a certified infection control nurse. So this is the QR code, and you can scan this QR code and you can register yourself for this program. There are a lot of changes we have brought it here for your better learning experience. There are a lot of activities, YouTube video suggestions from the Skills for Med, and that is the video itself conducted by the Skills for Med related to infection prevention and control. And you have projects and a lot of things we have changed, so you can go into that and you can experience yourself after enrolling for this program. And also about this AMSP, what I was talking about, the first batch successfully launched on Feb 3rd, and second batch, because we have a lot more inquiries are happening on the back about this program. So we thought of launching a second batch on May 1st week. So the course price is 4,999. This is the QR code. So we have only limited seats. There are only 30 seats we are allotting for this program. We are not taking more than that. So this is an opportunity. Scan this QR code and then register yourself for this program, and you will be enrolled into the May 1st batch. Yes, so we can open for the Q&A. So I'll bring up this slide again towards the end. And for your certificate, tomorrow after 4 p.m., you will receive the feedback link, and you can click and fill the form to get your certificate in less than 10 minutes. So open for Q&A. So meanwhile, this is the QR code to join our WhatsApp group, and also QR code to register for our ICN program. And Jay, you can post that. I think you have posted the link for what is that?
The handout and the AMS batch.
Handout. Yes, AMS batch too link. Okay.
There is there.
Thank you.
Any questions? I got to go. Got another 5 minutes.
Yes. So we have one question here in the Q&A portal. How to train security, front office and allied staff on these things. Also enjoy your session, especially your team visual presentation of various topics on. Okay, thank you so much. They have also asked the question, and equally the appreciation.
Yeah. I have to really thank the team, Stella, and several people whom you don't see, Diana, Jayanti, and Magesh, who do all this hard work. So a big thank you to the team. And to your question, how to train security. See, main thing is, the security comes in shifts, and mostly in the afternoon they're all together during the lunchtime when the shift changes. So you use that time to train the security, and it should be in the same language which they speak. Very, very important. And keep these trainings very short. Otherwise it should be just job related. So more than how to train, the question is how often to train. And that is where we don't do it. It has to be repeated again and again. So when in the US, there was a group of child psychologists who started a preschool TV program. It is known as Blue's Clues. It didn't come to India much, but in the US it was very famous. Blue's Clues. So it is like the blue clue on the screen, and that'll make the children learn. And what they did is, after studying how the children learn and remember, they put the same episode again and again for the first whole week. It will never change. Monday to Saturday, it will be the same episode again and again and again. So that way, the children learn by repetition. So repetition is the only way to learn. So that's where we, sort of fall short of our training. We just do it once in a time and then leave it. So repetitive training is what is going to change behaviors.
Yes. I think that's the one question I had in the Q&A portal. Definitely. Yeah.
Okay. All right. Thank you so
Yes.
much, Stella, for coordinating
Yes.
this, and thank you, everyone. I mean, again, we feel, we're talking about touch and humility. We are feeling so humbled that so many of you are coming for this Friday webinar and giving us the encouragement. Keep coming. Thank you so much for coming, listening, and please share the knowledge which you gain. Thank you so much.
Yes. Thank you so much, sir. I have a few announcements for them related to administrative things. So I will be taking over here. Thank you, sir. You're welcome to.
Yeah, thank you. Thank you so much.
Thank you. Yes. So I could see some of the messages on can we have the recordings? So for them, I would like to say we have the Skills for Med YouTube channel. So we are live streaming there, and post webinar you will have the entire session over there in the YouTube. So you do not have to worry. Whenever you find time, you can go look into our Skills for Men YouTube page, and you can even subscribe to get all the programs which is uploaded in our YouTube channel. So this is about one thing. And Jay, I think you have noted down the mail IDs of whom they all have said they are not able to access the QR code.
No, I personally messaged them to send me a message.
Sure. Perfect. So all have said that you have not able to access it. You can contact our Jayanti. She will help you out in your process. Last time we had one point from one of the participants from the Maldives. So they are not able to purchase the handout. They have given the feedback now. They are able to purchase the handout now. So what's happening with the WhatsApp QR code? Jay, the code is not working, it seems. Let me also try from my end what's happening. So let me bring it up the WhatsApp link for you all again here. Jay, I'm working on the QR code for the WhatsApp. So I have updated the WhatsApp QR code. You can, you can scan and join to our WhatsApp group. Thank you for raising this concern. Yes, of course. Who all have completed your registrations, you can leave the Zoom platform. So about the certificate, I would like to say it again. You will not receive the certificate automated unless you fill the feedback link. So you have to, for example, I could see Deepa Shri madam have asked about that and Sneha madam have asked about that. So you will receive your feedback link in your registered mail ID through which you have registered for the Zoom session. Okay. So tomorrow after 4 p.m., you check in your mail inbox, you would have received a feedback link and you have to click and fill that form and submit it. Then you will get the certificates. So if you have not receiving the feedback link in your inbox, kindly check in your spam box. Thank you so much. Jay, you can post that AMS recipe link and hand out recipe link again. Yes, of course, you have completed with all the process in the Zoom. You can leave the Zoom room, sir. Thank you.